So colon cancer in the United States is one of the most common internal malignancies. And in most patients, colon cancers can live in the gut for many, many years. And so symptoms do not become apparent until it's too late. So colonoscopy is one of the very few cancers that can be detected in its precancer state and be treated before ever causing long-term harm to patients. Unfortunately, colon cancer doesn't care about the pandemic, and so it's very important, even during this time, to come in and have your procedures done. For many years, the recommended age for colonoscopy has been at 50 years of age. New data is suggesting that many cancers are actually starting earlier, and so the current and future guidelines will probably be 45 years of age, assuming that you are at average risk with no symptoms whatsoever. So colonoscopy is a stepchild for many preventive cancer procedures, unfortunately. A lot of misconceptions exist. Probably some of the most common ones are that you have to have the procedure done often. And in most cases, you only need a colonoscopy every 10 or maybe 5 years. So it's not a procedure that you have to have done often. And the second is that you're going to have pain either during or after the colonoscopy, and neither of those are true. And so in most cases, people come in after a long night of doing a prep, and they have their procedure done and realize at the end of the day it wasn't nearly as bad as they had thought. So UMC Digestive Center performs probably every procedure related to the digestive tract in the United States that is currently available. So we do upper endoscopies, colonoscopies, we do endoscopic ultrasounds, a number of procedures as relates to the esophagus and the gut motility, and we also do a number of studies to look at liver stiffness in patients that have fatty liver. And so the UMC Digestive Center is the most comprehensive endoscopy center, certainly in the region, and it rivals any endoscopy unit and digestive health unit in the country. So a number of symptoms should be a warning sign that it's imperative to get to see a physician promptly. One is any changes in bowel habits. Those are always of concern. Certainly abdominal pain, particularly if it's new or bothersome, weight loss or changes in appetite, difficulty swallowing. Those are all the big ones that we think of, and any of those ought to prompt a visit urgently to a digestive health specialist. So the procedure itself is actually very straightforward. It takes about 20 to 30 minutes for a colonoscopy, and that includes looking through the lining of the entire colon and removing any precancerous polyps. So the procedure itself can take about 20 or 30 minutes, and then there's another 30-minute or so recovery. So people are in and out same day. There's no need to stay in the hospital. And once you leave, you can actually resume your regular diet and you're back to your usual activities very shortly. So I think the most important thing that we tell patients is that family history is an extremely important piece of information that your healthcare provider can use to try to risk stratify you and determine whether or not you need endoscopic procedures before we would ordinarily recommend them. So I think family history is the one thing that is readily available to you that would help us make better decisions about managing your care. So the Digestive Center at UMC is highly advanced, and that's essentially for three reasons. One is because it's got a very strong panel of digestive disease specialists and surgeons that span the entire breadth of digestive procedures. Two, it's very well staffed. We have the top-notch endoscopy nurses and techs in the community, and they are highly experienced. in any advanced endoscopic procedure. And finally, University Medical Center has invested an enormous amount of energy, resource, funds to supply and equip the endoscopy unit with state-of-the-art equipment. So there is no doubt that this unit is by far the most comprehensive in the entire city.